want to discuss ovarian cyst as one of the major causes of lower abdominal pain for women of reproductive age. Ovary is part of the reproductive organ in a woman. It's located within the pelvis. And every woman of reproductive age is supposed to have two ovaries, one located at both sides, at each side of the uterus. Now, cyst simply means collection of fluid within a sac. Any type of liquid, it can be water, it can be blood, it can be pus, anything in liquid form that is able to collect within a sac is what is called cyst. So ovarian cyst simply means collection of fluid within a sac that is located in the ovary. Now, cysts can be located anywhere, but we are concentrating on those ones that are within the ovary. There are majorly two types of ovarian cysts: functional cysts and pathological cysts. Functional cysts are those cysts that are being regulated by your menstrual cycle. They are connected to your menstrual cycle. While pathological cysts are those cysts that they are not being regulated by your menstrual cycle. They have nothing to do with your menstrual cycle. Then these functional cysts, there are many of them. We have follicular cysts, we have hemorrhagic cysts, and we have corpus luteum cysts. Then follicular cysts are those cysts that comes, as a woman, your menstrual cycle is divided into three phases. We have follicular phase, we have ovulatory phase, and we have luteal phase. Then follicular cysts are those cysts that occur within the follicular phase of your menstrual cycle. That is, if your menses starts today, your body will start preparation for ovulation by secreting a hormone called follicle stimulating hormone. That hormone will stimulate your ovary to start production of follicles that will rupture during ovulation. Then that follicle is supposed to grow 2.5 millimeters daily. It will keep growing until it gets to a point where it's called mature follicle. Before then, it's called immature follicle, but from 18 millimeters, it becomes mature follicle. That mature follicle will go to what we call Graafian follicle or dominant follicle, and that is the actual follicle that is supposed to rupture during ovulation. So if they scan you within this period of follicular phase, they will definitely see follicular cyst. That is the cyst that is preparing for ovulation. Now, if anything happens during ovulation that you did not ovulate, that cyst will remain there and it will keep on growing. It will get to a point when it will start giving you pains and you start complaining of pains within the lower abdomen. It can be within towards the right or the left. Then it will still keep on growing. At a point, it will start bleeding within itself, and that is when the pains will become more severe. And that is when most people will be presented to the hospital, and they will not tell you that you are having ovarian cyst. It's just a cyst, a follicle that did not rupture during ovulation that grows, but then we don't call it follicle again. The name now change to hemorrhagic cyst because it has passed follicular phase. Then there is another cyst that is called corpus luteum cyst. Corpus luteum cyst is as a result of post-ovulation. At that site of ovulation where you ovulated, another cyst can emanate from there. That is, if actually you are pregnant, if you are able to conceive, another cyst will come up from that site of ovulation. That cyst is meant to nourish that pregnancy. It's meant to secrete a hormone, produce a hormone called the progesterone that helps in keeping the pregnancy. It nourishes the pregnancy. So most persons at the first trimester, that's first 3 months of your pregnancy, they may tell you that you have ovarian cyst. Don't panic. It's part of what is keeping the pregnancy. If you terminate corpus luteum cyst, you may lose that pregnancy. Now, there are many causes of ovarian cyst, of functional cyst. Causes like hormonal disorder or hormonal imbalance. If your hormones are not balanced, you may be having anovulation. Anovulation means that you don't ovulate. You produce egg, but those eggs don't rupture during ovulation. Another cause of it is artificial family planning. both the pill, the insert, the injection, any type of artificial family planning can actually cause an ovulation. Because what it does is that it disrupts your hormone. It will tell your hormone not to function, and if the hormone that is supposed to rupture that follicle during ovulation is insufficient, it will not rupture. And once it did not rupture, it definitely turn to a cyst, a hemorrhagic cyst, or it will remain as functional cyst. Then another one is pills. Pills is any medication you take after unprotected sexual intercourse to stop you from conceiving. What it does is that it disrupts your hormone to stop you from taking in. So ovulation will not take place. And if ovulation doesn't take place, you end up in ovarian cyst. Then another cause of it is herbal medication. Most herbal medication cause ovarian cyst. Then one thing about this ovarian cyst is that they can regrow. That is, if you have ovarian cyst this month, you may have ovarian cyst next month. And that is why most people, they will go to hospital this month, they will tell you that you have ovarian cyst. 2-3 months to come, you will visit the hospital, you will still end up in another ovarian cyst. It may not be that first ovarian cyst. They do rupture. Most times they rupture within the 3rd week of your cycle. But even after rupturing, if they rupture within the 3rd week, within a week or 2 weeks, you start menstruating again, producing another cyst. And if that cyst doesn't rupture again, it will still get to another ovarian cyst. So when you have ovarian cyst this month and you don't treat it, you will still have ovarian cyst next month. Even if the one of this month ruptures, another ovarian cyst will still come up as long as the cause of it is still there. For some persons that will go for operation because of ovarian cyst, operation is not a solution to ovarian cyst. Most ovarian cysts don't even need treatment because they are supposed to rupture on its own, except very few that may refuse to rupture till after 4 weeks. You will now go for aspiration or to remove it. But aside that, most functional cysts don't need medication. And one more thing, functional cysts are all benign cysts. They are not cancerous. They are not malignant. They can never turn to cancer. Because I've seen people that a lady was crying that she have ovarian cyst, and now they say that it's turning into cancer. Of course, there are some ovarian cysts that are cancerous, but functional cysts are not cancerous. If you have functional cysts, it can never turn to cancer. The much it can do to you is that lower abdominal pain and abdominal protrusion, because something is growing, something is taking space, is taking accommodation within your lower abdomen. So most time you notice that your abdomen will protrude, and the pains it will give you, it will never turn to cancer. Please, there is another cyst called pathological cyst. There are many of them. Some cysts like cystic teratoma, endometrioma, even complex cysts. But I think that will be for next time. Let's stop here today. Next time we'll be picking pathological cysts one after the other to discuss, because they have different origin. Their presentations are different. We can't mix it up with this. So please, if you find this page educative, don't forget to share and like. Also comment at the comment section, and if you are not following my page, please do so, and remain safe. Thank you.